So right off the bat, let me assure you that this is no ordinary weight loss program. I'm Dr. Whit Roberts, and with 23 years of experience running 3 different medical and alternative healthcare clinics, I have created a unique and extremely effective weight loss program based on optimizing your health first and losing weight as a result. There's room for improvement in everybody's health, even the person who eats right, exercises regularly, and gets plenty of rest. The problem is knowing where to start or even what the main problem is that's keeping you from losing weight. Here's where you'll see the first big difference between my clinic and other weight loss programs. We take the time and make the effort to find your particular underlying health problem that is keeping you from reaching your weight goals and getting healthy and fit. So how do we do that? We use a device designed by the Russian space program and used on the Mir space station to monitor and treat their astronauts. We were the first to bring this to the United States. You'll be tested on this device when you first arrive in our clinic. I'm going to show you the device and explain how it works in just a minute, but first, I want to talk about weight loss in general. In my live seminars, I ask attendees, what makes it hard to lose weight and keep it off? In just a minute or two, they give me a long list of things that make it difficult. This list is a little different every time, but it might include some of the following. Food just tastes good. Social pressures. My husband brings home donuts, emotional eating, habits, addiction, stress, metabolic changes, infection, injuries, sedentary lifestyle or work environment, allergies or sensitivities, a bad microbiome, leaky gut, candida, parasites, hormone imbalances, diseases, your own body's survival mechanisms, genetics, lack of sleep or insomnia. The list can go on and on, but the point is there are many, many reasons that make it extremely difficult to lose weight and keep it off. If you have a combination of enough of these reasons, it can seem absolutely impossible. This is why it's a must to start with the cause. If you don't understand the cause, no one can address it. You're flying blind. So the first step is to get tested. This test is not like anything you have ever seen. Most tests are just snapshots in time. For example, a blood test looks at what's in your blood at the moment you get it drawn. And it only tests for a very few things at a time. There's a lot of room for misdiagnoses. As many of you know, there's nothing more frustrating for someone suffering with some chronic condition than to go to the doctor, get some blood drawn, and be pronounced perfectly healthy when you know darn well that you're sick. The blood test just can't see it. Well, the same is true with x-rays, CT scans, ultrasound, and MRIs. After getting 3 such special imaging tests, 6 medical doctors diagnosed my daughter with having been born with no uterus and no ovaries. They were all wrong. Our test is different. It is extremely different. First of all, it's not considered diagnostic by the medical profession, by the FDA, by me, or by anyone else, for that matter. It's not 100% accurate, but neither is any medical test. Let me tell you, though, the findings of this test are extremely valuable. In my opinion, this one test is often worth more than thousands of dollars of blood tests or special imaging. Why? Because it shows functional deficiencies in the body. What's a functional deficiency, you ask? Let me explain using diabetes as an example. You become diabetic when beta cells in your pancreas die or lose their ability to produce enough insulin. The crazy thing is that 70% of them have to die before a blood test can even detect a pre-diabetic state. How sad is that? Wouldn't it be of greater worth to see if some of those cells were struggling long before 70% of them died? Of course it would. A similar problem exists with thyroid cells. The disease process may have been progressing years before it shows up on a blood test. Our testing device can detect these early stages of disease when something can actually be done about it. Now, you may be wondering, if this is so good, why doesn't my doctor have one? And why isn't it covered by insurance? Well, there hasn't been enough testing to prove its validity and liability. 2 important criteria when insurance companies look at new medical equipment. Then why am I still using it? Because it has proven extremely valuable in my clinical experience. Just because medicine hasn't proven something yet doesn't mean it shouldn't be used. When I graduated from school and started practicing, it was almost heresy for a medical doctor to prescribe a vitamin. They wouldn't do it. even though millions of people have benefited from vitamin therapy. They wouldn't do it because it hadn't been proven. No one had paid for studies to prove the efficacy of vitamins. 25 years later, doctors prescribe tons of vitamins. How many more millions of people could they have helped if they had prescribed vitamins during those decades? It's the same story with this device. It hasn't been proven yet, but it has incredible clinical value. Take my patient Jim, for example. He's a young man who was in North Carolina doing missionary work and got so sick he had to come home early. He went to many doctors trying to find out why he was having such dramatic weight changes, was exhausted all the time, and had severe bowel pains. They ran tons of blood tests. They tested for parasites. They tested his thyroid and many other organs and found absolutely nothing wrong with him. This is unfortunately a common story. He came to my clinic and got tested with our device. It detected a lot of parasites that were not identified by the typical testing methods. We were able to take care of these with antiparasitic herbs, and he quickly regained his health. Now, I still need to show you the device, but before I do, I want to talk about what unusual and exciting things we do in our clinic to address what we find with this test. So let's say that the test finds that your weight issues are related to food sensitivities or allergies or even stressors from your environment. As you know, this is becoming a bigger problem all the time. Huge segments of the population can't eat wheat, corn, or dairy. Then even greater numbers of people have multiple food sensitivities they aren't even aware of. They just never feel good. They're tired all the time, have insomnia, ache all over, have swollen feet, keep gaining weight, or have any number of other symptoms, all because they're consuming foods that cause inflammation and compromise normal body functions. So if the test finds that this is the case with you, then we use stress reduction therapy. We'll wrap an electrode around the middle finger of both hands and run a small current through the body. A computer will measure how long it takes the current to get from one hand to the other. And while this current is flowing, you'll be introduced to frequencies that represent different foods and environmental stressors. Interestingly enough, your body reacts to these frequencies as if you were actually exposed to the food or other stressors, but only with a mild reaction that can be picked up by the computer as impedance to the current. In other words, if you're sensitive to bananas and we expose you to the frequency representative of bananas, the current slows down. This allows the computer to record all the foods and environmental stimuli that stress your body or cause inflammation. After the computer does all the cataloging of all this, then we will go back and reintroduce those frequencies. And when we reintroduce you to bananas, your body is like, oh yeah, this is bad. Then we expose your body to laser light. And why do we do that? Well, when exposed to laser light, your body secretes endorphins and enkephalins, feel-good chemicals. So it changes your body's reaction from, that to, that feels good. I must like bananas. In other words, the brain relabels bananas from bad to good. This is a powerful tool to correct sensitivities and decrease the overall inflammation in the body. Another problem the test can find is that your adrenals are deficient. If this is so, then we have to address that. Your adrenals are glands that sit on top of your kidneys and secrete hormones that manage your day-to-day stress. But when the glands that are supposed to manage stress are too stressed themselves, you go into a chronic state of fight or flight. It's as if you have been running from a bear for months. You're exhausted, but you can't sleep. You're anxious, depressed. You can't think clearly. You develop digestive problems, low libido, and a myriad of other problems. But you aren't actually running from a bear. So the extra sugar your body keeps dumping into the bloodstream for fuel to escape the bear gets turned into fat. This fat is usually really hard to get rid of. It accumulates around the middle. It's very stubborn. In this constant fight or flight state, you simply won't lose weight. So if the test finds adrenal deficiency, we use whole body magnetic resonance therapy using a device called a Magnosphere to bring you out of the chronic fight or flight state. This is a fascinating therapy. You will lay on a zero gravity chair and be bathed in a very powerful magnetic field. It's incredibly powerful, not because it's strong, but because it's very, very weak. In fact, the magnetic field it generates is 50 million times weaker than the magnetic field generated by the battery in your cell phone. Why is such a weak magnetic field so powerful? Because it mimics the natural magnetic fields generated by the cells and tissues of your body, which are essential to health and well-being. You see, disease, stress, and injury to the body alter the strength and frequency of these fields, which alters the physiology of your body. The Magnosphere normalizes these altered magnetic fields, restoring them to healthy states. There are numerous beneficial effects from this therapy. Balancing nervous system output between fight or flight and rest and digest functions is just one of them. Both in research and in clinical settings, we have seen this therapy help with symptoms as varied as anxiety, depression, insomnia, PTSD, shingles, Parkinson's, MS, atrial fibrillation, and many, many painful conditions. Okay, what if the test finds that you have an overgrowth of Candida? As many of you know, Candida is an opportunistic yeast infection. Under the right conditions, this yeast can grow throughout the body, causing inflammation and surprisingly long list of symptoms, stubborn weight being just one of them. And one of the reasons this overgrowth makes it hard to lose weight is that it causes you to crave sugar and carbohydrates. Now you may be wondering how yeast gets started or out of control in the first place. Well, it's a sad fact that if you have ever had an antibiotic in your life, even if the last time was as a toddler, you have set the stage for yeast overgrowth. Then eating carbs and sugar and alcohol feed this yeast. And then some medications even make it worse. It's very important to know if your struggles with weight are compounded by this problem. Then if they are, we prescribe supplements to help cleanse the bowels, establish the proper pH, and encourage healthy organisms to replace the yeast. If the yeast infection is severe, we may prescribe a special food plan to starve the yeast. Now, what if the test finds that a big part of your struggle is emotional? I'm always amazed at the almost universal struggle emotional eating is. The degree and variety of these struggles is fascinating and ranges from people trying to just find comfort and solace in food to severe anxiety and panic if there isn't enough food. This is where most diets and programs fail. They just don't address this incredibly vital aspect of weight loss. In our clinic, we use something called self-mastery technology. It works with the subconscious mind using light therapy to bring brainwave patterns into coherence. And research has found that greater coherence of brainwaves is associated with more integrated and effective thinking and behavior, including greater intelligence, creativity, learning ability, emotional stability, ethical and moral reasoning, self-confidence, and reduced anxiety. If that were all there was to it, it would be amazing. But there's more to it. While your brainwave patterns are in this more coherent state or super learning state, you listen to a hypnotherapy session where your relationship with food is reframed, giving you the tools and subconscious drive to eat right and take care of yourself. For most of our patients, this is their favorite therapy. It's incredibly relaxing and empowering. Let me give you one example. One of our patients has lost 179 pounds in our clinic and kept it off for 2 years. This is an incredible accomplishment. What's more incredible is that in the 2.5 years we've known her, she has never once eaten anything off the food plan that we gave her. How has she been able to do it? To resist social pressures and Christmas treats and birthday cakes and Thanksgiving pie? Well, she credits self-mastery technology. After she lost all the weight, she continued to come to the clinic every week for an entire year, reinforcing the appropriate brain patterns and habits. I love this technology. In addition to this incredible technology, each patient will be assigned a personal coach. Your coach has been trained to help you overcome these emotional roadblocks. I've run into people who don't think they really need a coach, but I'm here to tell you that the role of a personal coach cannot be overestimated. I've been in practice for 23 years. I did fine for most of those years, but then I got a personal coach and my practice exploded. Not because I suddenly knew more, but because my coach could see things in me that I could not see in myself. Okay, toxins. What if the test finds that your stubborn weight is due to toxins? We are exposed to an estimated 80,000 toxins every day. Many of these toxins are hormone disrupting. This means that they confuse the complex system of hormones, causing imbalances that can lead to disease and weight gain. Since you can't avoid these toxins, we have to make sure that your body is effectively handling them, that your liver and kidneys are clean and functioning as they should. Our testing will identify if there are deficiencies in your mechanisms of detoxification. If this is the case, we have a number of therapies we use to both eliminate toxins and improve your body's own ability to detoxify. First, we use an infrared sauna. This sauna is no ordinary gym sauna. It uses near, mid, and far infrared light to stimulate natural detoxification mechanisms deep within the body tissues. The heat of the sauna then helps sweat those toxins out. It requires the body to burn up to 1,000 calories to perform these functions. In addition to encouraging detoxification and calorie burn, infrared saunas have other proven health benefits, including longer life, better brain and heart health, increased athletic endurance, reduced pain from fibromyalgia, arthritis, and ankylosing spondylitis. 3 other therapies assist in detoxification. The first one is red light therapy. We have both red light laser and red LED lights. Banks of lasers and/or LED lights are positioned around fatty areas of the body. The frequency of these lights cause pores to be opened in the fat cells. These pores remain open for a period of about 3 days, and during this time, they literally leak fat and shrink in size. The average loss of fat in one session is between 2 and 6 inches. Although this sounds more cosmetic in nature, you have to remember that toxins are often stored in fat cells. In fact, we have to make sure that your liver is functioning well before this procedure so that it can process the added load of toxins being released. This is a detoxification process. It lowers the total body burden of toxins, but of course our patients love the dramatic inch loss as well. This process is always followed by the second of these therapies, whole body vibration. Whole body vibration stimulates the lymphatic system and helps direct the waste and leaked fat into lymphatic vessels. For the same reason as whole body vibration, we utilize lymphatic massage as the third of these therapies. Finally, we prescribe supplements to support phase 1 and phase 2 detoxification of the liver and support other functions of detoxification in other organs of the body. Now, the testing may find that you have undergone inappropriate metabolic changes. These changes may be due to many different causes, but can be addressed by the therapies and supplements we prescribe. A slowing metabolic rate is, of course, the primary concern with those who struggle with stubborn weight. One of the causes of this is oxygen deprivation from being overweight or not exercising. This oxygen deprivation leads to insulin resistance, which leads to more fat accumulation. One of our solutions is to give you more oxygen. When we do this, and we do this while you're on the body vibration therapy, this dramatic increase in oxygenation of tissues causes a greater metabolic rate and more rapid weight loss. So in this webinar, I have tried to do 2 things. First, give you an idea of how comprehensive our approach is, how we address every contributing factor keeping you from losing weight. And second, to help you understand how critical it is to get tested on our device so that you can know what it is that is keeping you from reaching your weight and fitness goals. Now, let me show you what a sample test and report look like. You can see here the huge list of items that we can search for. We can literally scan any tissue of the body, even the individual strands of DNA. But for the purpose of this webinar, I will just show you a scan of the colon or large bowel. As it scans, you will see an image representing the wall of the colon, and you'll see numbers pop up on the screen. On this portion of the test, we want to see mostly 1s, 2s, or 3s, indicating lower levels of inflammation. Unfortunately, on this scan, you see 4s and a couple of 5s, meaning there's likely some inflammatory process underway in these tissues. Now, we can look deeper at the results on a different screen. This screen shows a list of all the different things that could be going on in the colon. Fortunately, it lists the things in order of probability. The ones at the top are the only ones likely to be occurring. It also estimates the degree of severity. In this case, it indicates a likelihood that there is some colitis or inflammation in the bowel, and it shows intestinal dysbacteriosis, or more bad bacteria than good. If you recall from earlier in the webinar, I talked about how bad bacteria makes it so much harder to lose weight. This is what it looks like on the scan. The rest of the items are not really likely as they fall out of the likely range. When you come in and get tested, we'll test all of the most important organs and systems of the body and go over the results with you very thoroughly, giving you incredible insight into underlying and often hidden health problems, particularly those making it hard to lose weight. Your first step, though, is to come in to the clinic and get tested.
My name is Diane, and I have been coming to Health Utah for about 3 months. When I first came here, I had a scan done, which was amazing. That would show my all of my organs and if there were any problems with them. And after the 12-week program, I just had another scan done and was able to compare them side by side and see what improvement had been made, and I was amazed. I was completely amazed. It started a little bit about losing weight, but it turned into getting those scans healthier, my heart healthier, so I could be here for my family longer and feel better about it. And now being able to see it side by side is so exciting. I have lost 21 pounds and 20 inches. I lost 5.5 inches right around my waist, and I'm thrilled. My energy has increased. I'm not tired during the day at work. I'm not falling asleep at my monitor. I'm sleeping better. And my sugar cravings, which I never thought would ever go away because I was in love with sugar. And it was really just a wolf in sheep's clothing. You know, I loved it, but it was so not good for me in so many areas, and I'm good with not really having it. So Health Utah has been amazing. Dr. Roberts and what he does is incredible. Whenever I'm talking to friends and I hear somebody complain about this or that, I say, you need to go to Health Utah and have them do a scan and figure out why you're feeling like this, and talk with Dr. Roberts, and his staff is wonderful. All of them are so great. Every time I come in, I feel welcome, kind of like being at the Cheers bar.
I feel so much better. I've lost about 40 pounds. My headaches are feeling a lot better. I'm sleeping at night. Everything. I feel like I'm not constantly sick all the time, and so it's really nice to go forward and to feel like I have energy to live life and go forward in my life.
How long did it take to lose 40 pounds?
That was the 12 weeks.
Awesome. Okay, great job.
Hey, hi, I'm Leslie Rogers, and I just finished a 12-week program here at Health Utah, and I am down now 36 pounds as of today. That's in 3 months, 12 weeks. That's amazing. I'm also down 3 sizes, and the biggest gift that I have gained is I am now wearing my wedding band and ring set for the first time in over 17 years. That is my Christmas gift. So I'm so excited for that. Just a few of the benefits that I've received since I have been here is, number one, I believe now it's possible to lose weight. I did not think that I tried everything before, and I didn't believe that it was possible that I could ever lose weight, and I now know it's possible. And I also know now how to eat right. I have gained an education on what to eat, what feeds my body, and what helps me feel better. Some of the other benefits is I used to ache, like my bones just felt like they were broken, and I just ached all the time and hurt, and I have no pain now. I am pain free. I also itched everywhere. I would just constantly itch. I have no itching anymore. Some of the other things on the list, so I don't forget, is insomnia. I had horrible insomnia. I couldn't sleep. I would toss and turn all night. I had restless leg syndrome. That is all gone. Also depression, just horrible depression and anxiety. I no longer have depression and anxiety. I am so happy to be alive. And the list goes on and on. I just would recommend this to anybody who wants a new leash on life, who wants to find a reason to get up in the morning and to love themselves, and to feel better about themselves, this is the place. I am so, so grateful. And I just have to also say too, I love the people here. I have never ever gone to a medical facility of any kind where I felt totally accepted just for who I am and not judged for being ill or for the way I look or for anything. I'm always greeted with a smile. They're always happy to see me, and I just feel comfortable here. I don't feel vulnerable, and I'm so grateful for that. That really helped my journey here to become or get as far as I have. And so thank you so much. I'm grateful for that. And just come, try it out. You won't regret it.
I originally decided to come see Dr. Roberts at Health Utah because I had a broken metabolism. I could not lose weight, even doing all the right things. Since being here and following the program, I've not only had weight loss, I've lost 20 pounds, and I feel like those are permanently lost. I had a big flare-up, serious, worse than I've ever had in my life, of candida, and it's gone. And I also didn't know that I was as negative as I was, but it feels good to be so much more positive. My husband even has stated that I'm far more positive. I feel happy, much happier. I have a whole lot more energy. I've been able to bicycle a lot further than I was able to before, and with joy. And let's see, I was having serious problems with shingles, and much of those problems with shingles, like neuropathy and that, don't bother me anymore, except for sometimes a little tiny bit, but then I know that I need to get back on track, that perhaps I've fallen off the good path. I also have, the very first day that I came, I have a pain in my neck, had a pain in my neck from 1998, November 17th, an accident that I had that nearly killed me. And even the best of chiropractors were never able to put that back together. I happened to be the guinea pig in a demonstration for a group, and Dr. Roberts did this wonderful work that he does, and my body now knows and understands how to not recognize pain that really isn't there anymore, and I am pain-free there. Also, I have a lot more energy and just so many good things that I would say this is a good thing for anyone that has health problems.
My name is Heather. I'm 49 years old, and my husband and I went to a seminar here at Utah Health with Dr. Roberts back in April. We were really intrigued with the program. We did the body scan the first night when we came for the seminar, and we signed up that night. We saw results really quickly, and things like my energy have improved, my energy level, my skin has cleared up. I've lost 34 pounds. Before I started the program, I was dealing with a lot of premenopausal issues, hot flashes, and just all the discomfort and stuff that goes with premenopause stuff, and not sleeping well, low energy. And I could tell with each week of the program, as I was losing weight pretty regularly every week, all the other symptoms started to get better as well. And now I have all kinds of energy. I sleep great. I highly recommend the program to anybody who's having any of these symptoms or just wants to improve their overall health and well-being and energy. It's really the best money I have ever spent.
Hi, my name is Annalise Jensen, and I came to Health Utah about 12 weeks ago to just get healthier. I had really low energy and just basically didn't ever feel good. And I just finished the 12-week program, and I've lost 37 pounds, and I feel so much better, and I feel a lot more in control of my health. And Dr. Roberts is wonderful. He really cares about his patients and people, and he really wants to see them succeed. And the staff here is wonderful. They're very personable and just so friendly and help you along the way. And I've just loved it here, and I recommend it to everyone.